Morning everyone, Dr. Eric, the fitness physician, where I talk about all things related to hormonal fitness, muscle medicine, and much, much more. Longevity, gut health, functional medicine, precision medicine, cellular medicine, treating the body at the cellular level. And I'm helping everyone, especially those over 40, improve their health, hormones, and metabolism so they can live a life full of strength, energy, and vitality. I've launched my weight loss program, and of course I'm doing online telehealth consultations for hormone optimization, peptide therapy, longevity, and much, much more. So reach out to me if you want to work with me. Happy to take consultations, and of course I offer a ton of free content. I've been doing a little series on PCOS because it's a big problem. I see a lot of women with this who are struggling with hormonal issues, infertility, weight, hyperinsulinemia, fatty liver, and much, much more. And if you missed the first one or two, definitely listen to those. There's a lot of little subtle things and myths that I dispel. And again, it's a very common endocrinopathy in women. It's basically a lot of women are having issues, and you don't have to be overweight. You don't even have to have an elevated insulin level. And you can still have PCOS and still have problems, right? And this is going to lead to issues. And the reason why it's so important is because PCOS can lead to a high risk of cardiovascular disease, diabetes, overall inflammation, infertility, weight gain, fatty liver, breast cancer, uterine cancer, and much, much more. So, and I'll talk about that in the future. So again, the biggest problem is that it's a hyperinsulinemia. Trying to try to keep it so basically elevated insulin level or abnormal insulin response, because as I mentioned, you don't always have to have an elevated insulin level. It can be insulin resistance. And what can happen is, because of this, there's other factors and other hormones involved, which I'll talk about later, but you'll see typically a rise in androgens, total androgens, right? And so a lot of times with women, when I look at their lab work, we'll see sometimes, but again, not always, we'll typically see an elevation of her total testosterone level. Sometimes it's normal, and then sometimes we'll see an elevation in just the free testosterone. But the reason for that is there's a decrease in what's called SHBG, or sex hormone binding globulin. Now that's very important. You'll hear about this a lot online. People will talk about this, especially with guys, and talk about how you have to lower it, right? But that's not actually a good thing. You actually want an elevated SHBG because it's more predictive of better health outcomes, lower risk of cardiovascular disease, lower risk of cancer, and much, much more. But basically with these women, because of other things that are going on, I'm not going to get into, happening in the liver, insulin levels, and other liver responses and enzyme reactions and crosstalk, you'll get a drop in their SHBG, right? And this frees up estrogen, free estrogen and free testosterone, which normally is a good thing. But with these women, that can lead to the issues, because what happens, they have a hypersensitivity in the skin and the hair follicles. That's what leads to a lot of these symptoms. So again, it's not really a problem with the testosterone. The typical thought is, oh my gosh, we got to lower or block this testosterone. Well, you can do that, but they're still going to have this, and they're still going to have PCOS. So that's not the issue. The issue is the insulin and the inflammation. So, and I'm going to talk about that and how to fix that. So again, the lower SHBG, again, elevated free estrogen, free testosterone. Now this is the problem with women, is that the elevation of a cancer risk, again, not necessarily because of these, but because it's unbalanced, right? As I always talk about balance. What can happen is there's too much free estrogen and testosterone floating around. There's not enough progesterone. And again, you get that imbalance. It's like it's on a teeter-totter. And that's why women have missed periods or have irregular cycles. You get anovulatory cycles, meaning they're not having a complete cycle. And then they're not getting that release. Normally there's a rise and fall of estrogen and a rise and fall of progesterone, but they're getting all estrogen and not enough progesterone, so they're not having anovulatory cycles or missed cycles, and that's going to lead to an imbalance in the lining of the end of the uterus. And over time, this happens over and over and over, and you get a thickened endometrium, and you can eventually get some thickening of the tissue and abnormal, what we call hyperplasia, or abnormal growth, which can lead to a risk of uterine cancer, which is obviously not good. So to balance that out, we have to give progesterone and get the body back to its normal rhythm. Again, it's all about balance. The last thing I want to mention on this video is, again, we talk about the LH rise, right? Basically you get a rise in the LH. Normally we get those FSH and LH ratios that rise and fall again during the women's cycle. But what can happen is you get too much of that LH from that stimulation from what's going on with the insulin. And normally FSH is higher than the LH, but we get it, and there's a ratio that we look at, but oftentimes we get what's called the flip. You get too much LH and not enough FSH, and that, again, this is related to the change in the insulin and also to aldosterone, right? So because of this, there's a rise in aldosterone, which can, again, too much aldosterone can lead to inflammation and potential vascular disease long term, especially in women over 40. So that's why my women, they've had PCOS for decades. We always have to treat this, and I'll talk about that in the future, but that's a thing that's often missed when people are looking at PCOS, is looking at this LH and this aldosterone. Very, very important to address this. So, and again, sometimes, again, a lot of these things are missed. So anyway, like this video, tag it, post it, check out the next one. I'm going to keep talking about PCOS, but if you want to learn more about PCOS, you want to work with me one-on-one, please DM me below, type PCOS below. And ladies, if you got PCOS, if you've been misdiagnosed, had issues, hit me up below. Let me know. I'd love to hear from you. Again, check out my sites, primexweightloss.com for my online weight loss program. Unique coaching, accountability, and much more. Very different from everything that's out there, from everyone else who's kind of jumping on the weight loss bandwagon. I set my program apart with unique products, unique services that very few people have or anyone has. So reach out to me, and if you want to work with me from a hormonal perspective or anything else, drericprimex.com. Please reach out to me. Remember, do something nice for someone today. Pass it forward. Let's live to give. Everybody have an awesome day. We'll talk to you soon. Bye.